Well, good morning. My name is Seth Merowitz. I'm a partner at Best and Krieger, a California-based law firm, and let me welcome you to our session, Outpatient Facilities and the Health and Housing Nexus. Before I go ahead and allow the speakers to introduce themselves, let me wish a good morning, a good evening, a good afternoon. We've got folks all over the world that are coming in, which is really very exciting. I think we've got a wonderful panel for you, some really great lessons learned, concrete takeaways. So I'm very excited and thank my other panelists. It's been quite a year since this group came together last December in San Diego. That was a great session, really informative, and we're very happy to bring the band back together and add Laura this year. But really been quite a year, and our healthcare system has certainly been challenged in great ways. We've all been deeply affected by COVID. Despite those extreme challenges, we really do have bright days ahead. This topic, outpatient facilities, the health and housing nexus, is really a very exciting opportunity to take a look at how the existing healthcare industry can really benefit the community, how there can be more preventative care, wellness, how services can be brought closer to those in need, and not just have an impact on healthcare, but also housing, public safety, food access, jobs, and other community benefits. Rather than large hospitals, we're talking about more place-based outpatient facilities that are integrated into joint use and mixed use projects. This evolution within healthcare is changing the footprint of traditional medical office buildings. There are great innovations that are going on within clinics and urgent care and micro hospitals. And so we're here this evening, wherever you are, to hear from leaders in this area and hear about real world examples and lessons learned. Over the next 40 minutes, we're going to meet our panelists. Each panelist has a presentation. We will then have some internal Q&A, but we also invite you to add your questions that we will review and present to the panelists. So by way of introduction, again, Seth Merowitz, I'm a partner with Best and Krieger. We're a California-based full-service law firm. I've been practicing for 25 years, really land use, redevelopment, all advisory and transactional work. I don't do any litigation, try to help projects come together. And so I'm really agnostic as to asset class. I've been involved in all sorts of different projects along the way. The practice has really gone towards public-private partnerships. And so everything I touch has some component of that. And let me, with that introduction, ask Peter to introduce himself, and then Corin, and then Laura, and then we'll go back to Peter for the first presentation.
Thank you very much, Seth, and welcome everyone who's attending virtually. Peter Macronis, I'm a partner at Inception Property Group. Inception is a healthcare developer, advisory, and manager of healthcare, presently about 1 million square feet managed bi-coastally.
And I'm Corin Crawford, the Executive Vice President of Griffin Swinnerton. Griffin Swinnerton is a standalone development company with 2 partner firms, Griffin Structures and Swinnerton Builders. We operate as a developer contractor model where we integrate building construction into the development process. So that makes us a really good development partner for institutions and government. A lot of the work that we do is public-private partnerships, although we do a lot of build-to-suit opportunities with healthcare, higher ed, whether it's in a P3 framework or outside of that, and just a development partnership arrangement.
And I'm Laura Vandewey, a Chief Operating Officer for Decro Corporation, and we are a Southern California-based affordable housing developer with a few additional properties in Florida. I guess you could say we like the sunny spots. And 30-year-old organization with deep roots in community partnerships. All of our properties across the region include partnerships. And in this case, I'm very excited to talk to you about some of our new healthcare partnerships that we have, where we really are excited to bring the health into the affordable housing space so we can provide that access for the most vulnerable in our community.
Great.
Back to you, Scott.
Yeah, thank you all. So now we're going to bring in a slide deck that we have and will be posted to the conference website later today. And with that, I will ask Peter to present.
Good morning. Next slide, or I guess first slide. Peter Berkronis again, partner at Inception Property Group. Inception is an award-winning developer of healthcare facilities. We're also an advisory on healthcare facility design and management, project process flow. We're a broker. We're an equity financier of healthcare and senior living facilities. We're also a partner with private equity-backed real estate investment firm and healthcare services company, ShareMD, in the management, operations, improvements, and development of ShareMD's ever-growing portfolio of owned medical, office, and healthcare facilities. Presently 13 facilities and around 1 million square feet, half of which in Florida. Next slide. So 3 of the 4 of us in Inception senior leadership were at Kaiser Permanente. We had just under 29,000 square feet of assets under management between the 3 of us, one of the largest healthcare portfolios in the nation. We were involved in the visioning and the design and the rollout of Kaiser's own next generation of healthcare, which we're going to review. Also, subsequent to setting up Inception Property Group, we've been fortunate enough to advise a number of healthcare operators on their next generation of facilities, design, programming, construction, the back office of getting these approved internally. These each solve different needs that the healthcare providers have, and we'll sort of walk through these today. How healthcare has been rethought in terms of the 21st century, how technology has played into the design and the layout of these, how economic and social trends have involved the and advised the design of these facilities, and see how each of them has sort of addressed each of these needs. Next slide. So this is Kaiser Permanente's Project RAD, Reimagining Ambulatory Design. And these were examples of what's called RAD done right. At the end of a project, almost anyone will go back and see what worked well, what didn't work well, and the things that aren't worked well continually tweaked and evolved for the next level of projects. These are examples of RAD done right. It really was sort of turning healthcare from the traditional layout where you would walk into a doctor's office, you would be sitting in a waiting room, the staff would be behind a glass panel. Eventually you would be admitted into a long hallway with exam rooms. And you never really sort of got a feeling of being involved with the healthcare provider and sort of seeing how the cookie was being baked. Kaiser Permanente with Project RAD took a look at addressing the concerns of the patient as well as the staff. So when you look at a new Kaiser facility at the outside, it's warm, it's just cutting edge, it's reassuring. The palettes inside are a lot of pastels, a lot of different colors, a lot of warm colors, greens and yellows and oranges. They have a very open area. The design was sort of modeled on a restaurant chef's table, where you could sort of see the staff moving around behind and seeing sort of what's going on. So you didn't feel that disconnect between patient and staff. There's a tech bar, which allows students and people to charge electronic devices, use laptops and things like that, and have connectivity and productivity while they're waiting. There's different check-in kiosks now. You don't need to stand and present your card and get checked in. There's actually a swipe your card check-in kiosk that allows you to check yourself in. Great advancement in the time of COVID, because it limits that interaction between patient and staff member. And then in beta testing, which I was fortunate enough to see, and which they're starting to roll out now with COVID, patient visits with remote physician partners and live nurses, so that you can, in a waiting room, see a physician, or with a physician, see a specialist, or even from your home and now your smartphone, be able to have a visit with a healthcare provider. Next slide. So this is Ultimed's Clinic of the Future. Ultimed is the largest independent federally qualified healthcare center in the nation. That means that they're mostly Medicare and Medicaid, and because they're an FQHC, they actually have to have patients sitting on their board. Ultimed had different needs. Ultimed, the typical patient doesn't typically drive a car and arrive. Often they will come in a van with different generations of family members who will wait for the patient to be seen and brought back out. So there is different seating areas, things that are designed for different generations, chairs that are easy to get out of for those that are older areas, children's area for play and study and things like that. And a big driver for Ultimed was really the bringing in of natural light, not to have a cut-off internal environment, but really to have it be warm, sunny, natural, inviting. This also incorporated their lean design, which enhanced operational efficiencies and effectiveness, and it's now being rolled out within their Southern California portfolio. Next slide. So this was Inception Property Group's development in downtown Los Angeles, just west of Staples Center, called Downtown West Medical. Originally done for healthcare partners, now called Optum, a division of United Health Group. It's one of the nation's largest outpatient healthcare providers. So we were the first developer in the nation to use what was then healthcare providers' Autobahn design of flow of patient and staff within the facility. We first toured it when it was laid out in cardboard in one module, and they actually had staff and pretend patients come through and see patients, did some design tweaks. We took their design along with healthcare partners architect DPS and laid it out in a 4-story, 60,000 square foot medical office building, part of a 3-building healthcare campus that we developed. Healthcare partners really was looking to increase and streamline and make more effective the flow of the patient into the facility. So you would come in, you do come in and are assigned a floor and an area. You see on the far left of my slide, you'll see a B. You'll be sent to floor 4, A, B, and C, 3 or 2, A, B, and C, where depending on whether you're seeing urgent care, primary care, specialty care, or surgical specialties, you're sort of queued up. You then, in the center photo on that slide, are seen by a physician, nurse assistant, or so on. And then the back office, which you'll see to the right, are flexible nurse and physician workstations. At the far end of that photo are private offices for physicians, break rooms, locker rooms, things like that. So it was really, they call it the Autobahn design because of on that far left slide, that hallway. It was really all about maximizing the flow of patients to see as many sort of patients as they can, as effectively as they can, while also having a good experience for both the patient and the provider, not having it be a conveyor belt, but having it be very, very efficient. And now they are rolling this out nationwide. Next slide. So this is the one that Inception Property Group has not been involved in directly or indirectly, but I thought was really neat. Forward. Forward is a private equity-backed, Silicon Valley-based, next-generation primary care provider, really catered toward the affluent, those who are looking for primary care service. Most of Ford's facilities are located in retail clinics, retail centers. Here in Los Angeles, it's at the Americana at Brand, for example. You set an appointment by phone, no one to call. You arrive, and it's very warm, yet very next generation Star Trek, Star Wars. A lot of white, a lot of blue light, a lot of next generation feeling tools to measure your height, your weight, your body mass, all sorts of things. You're seen by a concierge, not necessarily a nurse or a physician, who guides you through what your health is. And then at the end, you see a physician or a nurse practitioner in something that most definitely does not resemble your typical exam room, but on purpose. They really are sort of looking at artificial intelligence and bots and other sorts of things to really sort of provide a next generation, very much a concierge level of healthcare. Next slide. And I can't help but finish up with this. Our downtown medical project there on the left, you'll see our parking structures LED artwork. It's called Prelude DTLA. And not only is it visible from the 10 freeway just west of downtown, which you'll see in the distance, but if you're flying into LAX and if you're sitting on the right side of the plane at a window seat, you see Prelude DTLA. And of course, when I fly into LAX, I try to make it at night and I try to sit on the right side of the plane. And with that, I will bounce it back to Seth. Thank you very much.
Yeah, Peter, absolutely a great, insightful presentation. Thank you so much. And right on time, Peter. Thank you very much.
Great.
Next, we'll move over to Corin Crawford.
Okay, well, so let's talk a little bit. I think it's worth talking about how we approach and our thinking about this particular topic. And I really like this slide because it's rooted in what we see and what is currently going on with underpinning the change in healthcare delivery. You've got this on the left-hand side, this historical and current fee-for-service model. And on the right-hand side, you've got a value-based payment population health model. On the historical side, I think that what people observe about healthcare is that 80% of healthcare expenditures and investment go towards acute intensive conditions. If you get sick and you have an acute condition, you get a procedure, or it's the health system is based on curing something that is present in you. But the truth is, the acute intensive conditions are, the last of a long chain, beginning with and starting with sort of a healthy living. And healthy living is also synonymous with prevention, right? Being well educated on your health, having healthy habits, and the like. And that's sort of the underpinnings of value-based care and payment. So the healthcare model is shifting, and on the right-hand side, you see how it would be, theoretically, I guess, and most people who are involved in value-based care, especially for the Forward firm and others who are thinking about healthcare innovation, are looking at redirecting healthcare expenditures and the focus of healthcare for prevention all the way, down, starting with prevention all the way upstream to acute intensive, where 80% of the focus and investment is based on prevention rather than, on the left-hand side, acute and intensive. And the real estate implications of this really speak to our panel topic, right? Like smaller scale, tech-enabled facilities that meet people where they are in community-focused settings like retail or mixed-use community development. And then starting with prevention and then moving more upstream to acute care, where probably less investment over time is going to be involved in kind of really large, voluminous general hospitals, general care hospitals. And so similar with a value-based care model really speaks to the social determinants of health, where 90% of your health outcomes are really driven by these social determinants, like access to food, housing, mental health, transportation, education level, jobs. And so you start to see health systems shift where they invest. And it may, surprisingly, some people are surprised to hear about very large health systems like a Kaiser or Dignity Health or Sutter really getting involved in investing into community issues like access to jobs and employee training, or just workforce training in general, and sustainable food. So that's that then leads into strategically our thinking and interest in wellness districts, mixed use community settings where health is embedded across a variety of different property types, from housing to flex commercial space to medical offices, the historical medical office. And this is a diagram of a wellness district that we serve, that serves for us as inspiration. And so is this. This is a different look at a health campus, health and well-being campus that integrates farming and greenhouses and community gardens with a teaching kitchen, mental health services, dental community spaces, and education, a preschool and an academy. This is a project that's really interesting for us that's going on in Denver. And then flipping to projects that we have under development, And there are two projects I'm going to speak about. One is the Placer County Government Center. This is a public-private partnership that Griffin Swinnerton was awarded to be the master developer over about 50 acres of surplus land in Placer County, just outside of Sacramento. And we're using this thinking, this community-based thinking, this understanding of what health and wellness as a organizing lens for community centers of the future. And so here's a rendering of a health and wellness village, superimposed onto the surplus land. So if you kind of want to get a look at some forward looking at the type of design and planning and partnership creation that we're having with not only healthcare providers, but also developers, including ourselves. We're playing a role as master developer and build to suit partner, but the opportunities here involve a broad spectrum of different types of uses, including housing, a variety of different types, health and wellness for, health and wellness more holistically speaking. That could include yoga and, physical therapy and markets, in addition to clinics and outpatient facilities. And then we also similarly have, we are the developers of the Rancho Cordova Civic Center. And this is a civic center also for a city that's near Sacramento. And these similar kinds of this master planning and design and use, this community-based wellness as a thematic development principle, I guess, is driving the master planning work that we're currently underway within the city. And so this is a kind of a look at what a health and wellness theme looks like for this civic center. It's a 10-acre campus across. It's a transit-oriented development across from the Mills Station, light rail station, and the orienting site planning characteristic is this wellness park that kind of grounds housing as well as a diversity of different wellness-oriented uses, from a community health clinic to exercise and flex spaces, a fresh market, a teaching kitchen, community gardens, retail, ancillary retail, and a learning center. So that's where we are, and I'd like to hand it off to Laura.
Thank you.
Corin, beautiful presentation, inspiring and wonderful examples, and ahead of time. So very good. Laura, welcome. We look forward to hearing from you.
Thank you. So I'm here to discuss our flagship project, which is really DECRO Corporation's first foray into the mixed use world. And I think it couldn't be more timely with what we have going on in the last year as it relates to the pandemic. This project is in the Lincoln Heights community of Los Angeles, and it includes a campus concept with 4 separate buildings. What you're looking at here on this corner is actually the primary building for the residents, which includes residential affordable housing over grocery. If you go to the next slide, please. Again, located in Lincoln Heights, for those of you who may not be familiar with the Los Angeles area, Lincoln Heights is just a little northeast of downtown Los Angeles, but still, within the downtown influence. And one thing of note is it's also within a half a mile of the County USC Medical Complex. So the idea was to extend out in this location and identify the assets of the surrounding community and then make them even more accessible. Next slide. But we wanted to confirm with the community first that they identified the need, because sometimes we think, oh, there's a hospital there if the community doesn't need medical services. But as we all know, hospitals don't equal preventative care, or at least they shouldn't, right? That should be that acute space, as Corin referred to. That shouldn't be where we're going to, get our basic updates and checkups and those sorts of things. And our assumptions were correct when we did a survey of the surrounding community. We went door to door just to make sure that they saw the same needs that we did. One thing to note that this location is a USDA certified food desert, which means there is also not a grocery that's easily accessible to this community. So the market was one of the first priorities, but the second priority was medical. And in order to respond to that, then that informed our program. Next slide. And this is what we came up with, that we would provide community serving retail, in this case, a grocery store, where we would provide that access to fresh food. This is a severely distressed, economically distressed neighborhood. So all the more reason that we provide that access to fresh food. And then a medical office space is provided, as well as a pediatric mental health clinic. And that is really leveraging the strengths of one of our partner, in this case, the Violence Intervention Program is our partner on this project. And I'll speak to them a bit more later. And a more generic community medical clinic is provided, plus the affordable housing units, the 97 affordable housing units, which are going to be housing not just families, but also seniors. And for those of you who might be unfamiliar with the affordable housing industry, there is a very strong push, especially in the Los Angeles area, to distinguish between what's called permanent supportive housing and affordable housing. Permanent supportive housing is really housing of the homeless, and acknowledging that any individual who's experienced homelessness may also have mental health needs, because it is such a traumatic event to live on the street. So often they experience PTSD and other things. In addition, there's a much higher prevalence of domestic violence. So our project in particular will include survivors of domestic violence, as well as what are called transition age youth. And transition age youth are those youth that are too old for the foster care system, but still under age 25. And then, of course, we have to park all of this. So the last is a parking structure. And in addition, because no project in LA doesn't include some form of extra level of complexity, there are 3 historic structures that we are having to relocate within the site. If you go to the next slide, you'll see how this all lays out in the campus plan. So we have building 1 again, which is this mixed-use tower that you saw on the first slide, where we'll have the retail on the ground floor, which we hope will include a grocer and access to fresh food. And then building 2 is a more general community serving medical clinic that is easily accessible from the bus stop on the corner. And building 3 is a larger medical office. And this is a building where we're still in discussions with a couple of regional medical providers, but the thought is that this could, in a perfect world, be dedicated to seniors because of our population having such a strong, the largest percentage of the residential population will be seniors. We're hopeful that that can be a future geriatric clinic or a senior service-focused facility. And then lastly, the medical clinic is building 4, which includes those 3 small historic homes that are being repurposed and create that small scale environment for children who have experienced either child abuse or were born with fetal alcohol spectrum disorder. All of this is to make a campus experience that we hope will really bring health and housing, of course, to one location and create long-term stability, especially for those 49 of the 97 units of housing are for the formerly homeless. So in order to assure success for that population, their stability and acceptance of becoming housed again, it is really important to have full wraparound services. So if you go to the next slide. This is an overview of all 4 of the buildings and how it will appear in the future. We already looked at building 1 there, which is that housing and retail on the ground floor. Building 2 is that medical clinic from the street with the goal of really making that accessibility. And in sharp contrast to what you have at the County USC Medical Complex, which is only a half a mile away, there is I want to say it's several football fields that the community has to walk to access that facility. This is really trying to get the health out easily accessible in almost a retail setting to the community. Then building 3, as I mentioned, has the parking that accommodates all of the other buildings, plus the medical offices above, which we hope will be in a collaborative nature supporting the surrounding buildings. And then we have our clinic. Next slide. So I was speaking earlier about the importance of the supportive housing component to this. And one thing that some of the listeners may not be aware of is in the affordable housing space, homelessness is reached historic levels of it's a disaster. I don't know what else to say, right? Every city we go to, especially in the warmer regions, the crisis is extreme, exacerbated by the pandemic. So it is so important that we provide the wraparound services to ensure the health and wellness of these new residents as the housing is being built across Los Angeles. So we provide within the development those services, plus all of the additional training and programs to ensure their success. So I just wanted to point out, with the on-site medical clinics, of course, you can imagine that'll only further their likelihood of success. But the on-site mental health as well is just as important. And I can't underscore that enough, the need for mental health services within the residential community. Next slide. This is also something that's important. Having the space in the building to not just house the residents, but to bring them together and create a strong community. So this is highlighting the community spaces that are on the second floor above the retail. We'll have classrooms where we can come together and educate them on nutrition, a teaching kitchen as well, not just to educate on culinary arts skills, those nutritional skills, another form of preventative measure, right, where we actually affect the diet, which in turn affects the individual's long-term success for having a healthy body, but also potentially jobs, trainings, opportunities. This TAY population, age 18 to 25, we hope will be able to not just learn the nutritional skills, but then take those skills once our restaurants can reopen again, which I know across the country we are all eagerly anticipating that, to be able to take those skills elsewhere and also hopefully make a living for themselves as well. So the idea is that in addition to housing, affordable housing also needs to include these spaces to gather, to encourage, we have fitness rooms, we have resource centers. It's much more than just building 4 walls to put a bed and have a bathroom for hygiene. It also includes community building and health skills building, in addition to a physical space to lay there at night. Next slide. And the most important thing is having a good partner. And I would say for Decro Corporation, as I've mentioned, we have a history of partnerships, strong partnerships across the region. In this case, there's no exception to that. VIP is an extraordinary partner with a very deep understanding of the mental health challenges of our population that we hope to house in this building. In addition to seeing over 70% of the child abuse cases across the county, they also have an elder abuse clinic. Elder abuse is on the rise, shockingly, very sadly. And so the senior population, we are very eager to be able to work with to build their skills, to protect themselves in that as well, and build that strong mental health. And with that, I will turn it back to Seth and say thank you very much for this opportunity to share our program.
Thank you, Laura and Corin, Peter. Just an outstanding presentation. You've done a wonderful survey of lots of different examples taking place in our state. So thank you very much for your preparation. Your inspiring presentation and the projects you're working on. Let me first encourage our listeners, if you have a question, to please send it in. You're also free to follow up with any of us afterwards. We're certainly happy to discuss further. Let me put a couple of questions out to the group. Peter, from your RAD Done Right, Corin, the different models that you've brought from Placer County and City of Rancho Cordova, Laura, the brine. But let's talk about joint use and mixed use, right? We're putting multiple users on a site. What thoughts do you have? What did you think would work and hasn't worked? What has worked particularly well in that setting? Any thoughts that you have on that joint use, mixed use?
Well, this is Peter. I guess I'll go first. I think that it's imperative that you include, as Laura and Cord has mentioned, the community and the involvement of the community. Gone are the days of building a healthcare citadel, standing alone on a hill away from everyone.
Yes.
With our Downtown West Medical Project, we very much started actually with a city council person's office and said, here's the site, here's what we're planning on doing, here's a couple of different layouts. They very much wanted to make sure that we didn't have our back to the community, that we had our face and our front to the community. We also designed the property around a central plaza. That plaza is not only for drop-off of Uber and people in medical transport, but we also specifically designed it so they can house a farmer's market, because in its area, which is sort of Pico Union, is also very much a food desert. And the city council person's office was amazed that we would think about having a farmer's market, but it's just all part of the continuum of care. Access to healthy foods was something that was paramount. Corin?
Yeah, I would just echo a lot of what Peter had to say, particularly around, going back to that slide that I had on the social determinants of health. If you use that as a guide for community planning, then health as a frame starts to address not only health facilities themselves, clinics or outpatient facilities and procedures, but exercise and access to food and education and public safety, and all of these sort of environmental factors that improve wellness. So we use that as a lens for planning, and then obviously you integrate with the community and really listen to the community's needs and wants, and look at supply and demand, but also just listening to the community and looking at serving the needs that you're hearing. The other thing I think I would add really is to just I can't emphasize enough the community spaces, the public spaces. So we often think about development with respect to a building, a vertical structure, and what goes on within those vertical structures. But the truth is, in today's day and age, your outdoor spaces, like we're learning with COVID, is a facility in and of itself that has planning, that has programming, that essentially needs to be managed and operated and curated and programmed in the same way that your indoor spaces are. And that's actually very, very exciting, because it, just from a pure economic standpoint, is like another revenue stream that you can monetize from a facility standpoint. But beyond that, it just adds to the activity. It adds to the vibrancy of a place. And so if you just want to look at it from an urban planning and design and community building standpoint, you've got that checked off. But if you want to also look at it as a revenue opportunity, that's also another economic lens you can bring to it.
I would add to that, having those community spaces, that's why I wanted to emphasize that slide, that, of course, we want to make sure you bring the community together as a building, especially if you have a mixed generation building like we're proposing, which is also pretty innovative in itself. There aren't many of those, but also having the ability to bring in the outside community and really connect your campus to the outside world. Those open spaces where people can congregate outside are so important. Programming those, don't just, throw down a bunch of trees and think it looks pretty. Make it active, activate, engage the community, create pedestrian corridors, bring down the scale. So it's accessible also for those without cars. And don't just, have a parking lot, right? Because the odds are the majority of our population will not be coming in vehicles. They'll be coming on foot. So making sure that you aren't just focused on the parking, you're focused really on the experience, as Peter especially is, and Corinne's in their work they're doing, emphasizes as well. The community, you won't win over everyone. I can't say that we've got 100% support of the community. There are always people that say, oh, it's so big. But you also, you need to recognize, especially in urban areas, that if you're going to put in the effort and to make the impact, let's make an impact. Let's actually address the issues while you have the energy behind it. We couldn't be more excited with the ability to bring all of these uses together, and also we hope replicate this in the future, right? Starting those partnerships, which I'm sure you're looking to do as well in your other locations, Corinne and Peter.
So let me ask one or two more questions. We're getting to the end. If there are any questions from the audience, please send them in. Each of you touched on, let's call it the public realm. Each of you talked about Central Plaza, the community assets, designing around that central core. So what, in addition to the public realm, you've covered that, what other advice do you have for owners, operators, investors in improving facility design for success? And maybe we'll go the other way, Laura, then Corinne, then Peter.
Sure. I think...
and this will be the lightning round.
Lightning round, yeah. Just be thoughtful. Don't utilize every corner, every inch of the site, and take advantage of the assets. When you're thrown a challenge of a historic building, think about who the best tenant for that building is. You've got an opportunity to bring scale down for a child and keep that experience, that therapy experience, less scary for them, right? Make sure that each of the buildings is designed to maximize the healing that it has the potential to deliver to the community. That's why every building has a different end user in mind, for ours. So you want to maximize the real estate while maximizing the healing potential of each square inch of that real estate.
Beautiful. Thank you. Corinne?
Really quickly, I would just say that the other thing is really the impact of technology on healthcare delivery. A lot of health systems are thinking a lot about telehealth and the fact that healthcare can be administered in the home. And so if you take a value first, home-based approach to healthcare, that also is greatly impacting the, facility footprint, like the Forward example Peter had. And we're seeing experiments play out, just like we saw over the last, 20 years or so, the evolution of e-commerce and how Amazon and all the other players kind of evolved the commerce space, the shopping space, and what it's done to traditional retail. We're gonna see, it's just beginning in the healthcare space. So it's just really going to be interesting to monitor it and kind of take an experimenter's mindset.
Great. Peter, you get the final word.
Start with listening. Don't start planning. Involve the community, involve the elected officials, see what else needs to be addressed, and see how you can address that in your project.
Great. So let me conclude and thank our panelists very much. Laura Vanderway, Corinne Crawford, Peter Berkronis. Absolutely a fantastic presentation. And I look forward to doing it again next year. That would be a three-peat. And hopefully we'll be together. We'll be post-corona. We'll have the opportunity to come together and interact more with our audience, which is very important. I will share we were getting updates during the presentation, and the audience has grown during the presentation. And so I really credit my co-panelists with that. And I thank you very much to the conference organizers. And with that, we will wish you a good morning, a good night, a good afternoon. All the best.
Aye. Thank you.
Thank you all very much. It's been an honor.
Thank you.
Same.